Hey there, I'm Dr. Sanjay Gupta. This morning, 3 very important yet complicated stories that we're going to make sure you understand at the end of this half hour. America's health system is changing. That means your insurance coverage is changing as well. Why the Supreme Court is now getting involved. Then, using stem cells to fix the damage from a heart attack. The surprising new evidence. And what's behind a critical shortage of cancer drugs. Plus, rapper Fat Joe drops a body. I hate it like a freak though. Why he's not so fat anymore. But we begin, though, with big news out of Washington. The Supreme Court says it will decide a challenge to the sweeping health care law that President Obama signed last year. A lot of people have been paying attention to this. The main issue is the controversial requirement that everyone be covered by insurance. It's called the mandate. Starting in 2014, if you don't have coverage through a job or Medicare or Medicaid, you have to buy it yourself. Now, while there are subsidies for those who can't afford it, this specific part of the law requiring the mandate has been unpopular. But according to a new CNN ORC poll, a majority of Americans are now in favor of it overall. Joining me from New York is NYU Langone Medical Center, Andrew Rubin. He's been on the show before. He's the host of Healthcare Connect on SiriusXM Doctor Radio. Andrew, you and I have been talking about this for some time now. First of all, let me start off just simply. Did this surprise you at all? The Supreme Court is taking this on?
No, we knew this was going to happen. In fact, it's really the best way to get to the finish line on whether healthcare reform is going to survive, because it's been going back and forth in the courts for far too long.
Well, and now give it to me straight here. Patients ask me this all the time as a doctor. If the Supreme Court overturns healthcare reform, what does that mean for the healthcare overall? What does it mean for this whole plan, this whole bill overall?
Okay, well, you have to remember, healthcare reform has 2 parts. One is health insurance reform, and that's really what this individual mandate is all about. Now, if the individual mandate is overturned by the Supreme Court, then it really throws into question the entire healthcare reform bill and law at this point, which is really restructuring the entire healthcare system.
Andrew, I don't know if you've done this recently. I did open enrollment. A lot of companies have these, to figure out their health insurance. There are some big changes for next year. And I think one message is clear. You shouldn't assume your coverage for next year is going to be the same as it was for this year. Do you have any advice, I mean, based on everything you know, what you're seeing for people filling out their open enrollment in terms of the changes coming down?
Yeah, Sanjay, big changes this year. In fact, insurance premiums for employers went up 10% last year. For the average employee, it's $10,000 across the United States. It's a really big number. So last year, about 20% of employees offered these high deductible consumer-directed plans. This year, the number is 32%. And the problem is with the high deductible consumer-directed plan is they look very similar to older plans. And if you're not really reading the fine print, you could be very surprised to see that you now have a $2,000 or $2,500 deductible, where last year the same insurance came with a $1,000 deductible. So the message is, make sure you read your benefit plan and you understand what you're buying before you actually enroll in it.
Do you, when you are giving advice and you manage a big provider network, is there some basic advice that you say in terms of people saying to make sure they get the best coverage, the best insurance overall, and that they protect themselves from huge bills?
I do. There are a couple of things. Number one, I've been saying this a lot lately, and I really believe it, but it's a hard concept for a lot of Americans to understand. An HMO or an EPO, which is like an HMO, but it doesn't require a referral to see a specialist, can be a very cost-effective insurance plan for a lot of people to choose. You don't typically have deductibles, and there are no co-insurance amounts. The problem is you have to stay in network. So you're essentially turning the management of your health care over to a very controlled network of doctors. If you're willing to make that compromise, you can save yourself a lot of money. Heretofore, a lot of Americans didn't like that restrictive behavior on the part of employers or insurance companies, so they went with these PPO plans where they had out-of-network benefits. Those out-of-network benefits are becoming increasingly expensive for employees, because the more you go out-of-network, the more the employers are making you pick up a bigger percentage of those costs.
You know, you're so good, Andrew, at giving us the big picture and obviously the details of the picture as well. You know, I have a feeling you and I are going to be talking quite a bit over the next few years.
Oh, absolutely. Many years.
Thanks for joining us. As always, Andrew Rubin.